Hello everyone, and welcome to another audio podcast in this series on the Rogue Storm episode. This is an audio podcast in regarding pediatric transfusion, and this is the Shientist, and it's another Storm Robotics production. So a little background, a little bit of background. So pediatric blood is supplied as mainly suitable for neonates, suitable for what is known as what is referred to as exchange transfusion, and also what is suitable for intrauterine transfusion. In relating to a general anemia and pediatrics and young people, so apart from hemolytic disease of the fetus or hemolytic disease of the newborn, common causes in the United Kingdom at least are in regards to viral or particular parvoviruses, and also where a twin-to-twin transfusion and twin-to-twin transfusion can cause anemia when due to something that's referred to anastomosis, which is the joining of twins, basically, wherein there may be HDF, hemolytic disease of the fetus, or hemolytic disease of the newborn. Neonatal anemia, on the other hand, is generally one of the most common causes or abnormalities in newborn infants. And some of the causes also include general blood loss, occult hemorrhage before birth. So, for example, where there can be evidence of fetal or maternal hemorrhage, there can be twin-to-twin hemorrhage, and there can be internal hemorrhage. For example, intracranial hemorrhage. And there's also in related to hemorrhage and in relating to blood loss, there's there can be iatrogenic blood loss, which can be for example can be a cause due to blood sampling as well. So in relating in regards to hemolysis now, where hemolysis is concerned, there can be alloimmune causes. So for example, again, hemolytic disease of the newborn. There's autoimmune, which can be, for example, maternal autoimmune hemolytic anemia. There can be DIC, or which is disseminated intravascular coagulation. There can be red cell membrane disorders, for example, hereditary spherocytosis. And in relating to also hemolysis, there can be red cell enzyme deficiency. So, for example, PK deficiency. In relating to impaired red cell production, impaired red cell production, there can be congenital abnormalities. So, for example, congenital infection may result as if and wherein pediatrics or young people may be diagnosed with cytomegalovirus or CMV. There can be congenital leukemia as a result of impaired red cell production, and also transient erythroblastopenia, anemia, and in relating to something that is referred to as diamond Blackfan syndrome, which is specific to pediatrics and young people with particular form of hematological abnormality. In relating to that as well, there's anemia of prematurity. So, for example, where generally the hemoglobin can be in the range of 6.5 to 9 grams per deciliter, or potentially less. The guidelines around anemia of prematurity sort of varies from region to region, since the cutoffs can also be related, or in regards to demographics, the demographics around particular aspects of epidemiology as well. And something else that's that literature is a little bit vague on, in relating to pediatrics and young people, in relating to transfusion. Some aspects of transfusion practice is where historically, for example, pediatrics or young people are rarely in need or requirement for transfusion and for blood transfusions, for example. However, most children, in line with this, most children will never require transfusion unless they have a serious or rare hematological condition wherein there is evidence to indicate that blood transfusion would serve as, number one, life-saving, and number two, replenishing aspects of hypovolemia, where there is low volume of particular cells and particular cells that are important in sustaining life, notwithstanding the main red cell components. Historically, also in literature, it has informed, or literature informs that pediatrics or young people would be rare candidates to have blood transfusions at all. However, as advances have been made in areas of clinical practice, etc., patients who are diagnosed with particular conditions may require transfusion, blood transfusion, as part of their particular areas of particular clinical practice, but also in relating to particular care pathways as well. So there are several groups of patients, however, who are also frequently transfused, and for example, for example, these can include those with transfusion-dependent hereditary disorders. So, for example, thalassemia major or sickle cell disease, and those undergoing forms of chemotherapy for the treatment of particular leukemias. So I'm going to highlight a little bit of a description of red cell products available for fetal and neonatal use as well. So in this table, on this table here, it's I've got an outline of particular indices. So there's red cell components, there's irradiated, there's a hematocrit range, there's the volume, and then there's expiry, and then there's a group in relating to the blood group. Now, under red cell component, there's a neonatal, there's a neonatal, what's referred as a top up, and under irradiated, it's plus or minus. So the red cell component for pediatrics under this particular category, where they may need a top up on particular red cells, for example, they can have their historically they can have their literature informs that pediatrics or young people can benefit from irradiated irradiated or non-irradiated plus or minus, which is also referred to as leukodepleted, or where there are still some potential leukocytes within red cells, within a bag of in a pack of blood. And the hematocrit range would be in the line of 0.5 to 0.7, and the volume of red cells under this particular category that would be required as a sort of a general basis would be a sort of eight packs of 25 to 40 mils of red cells. Ideally, the expiration date should be less than 35 days, or within that sort of timeline. And in regards to blood group, for example, it should be a group O, negative or positive, and technically, blood group O would be ideal in relating to red cells for fetal or neonatal use. There are then sort of in this table an overview of exchange and intrauterine as well. However, the table is there for a general reference, so feel free to have a look and cross-reference with literature where applicable. And so, in summary, there are various or several sort of underpinnings as to why pediatrics may require a transfusion. So generally, there can be immunological concerns. There can be hemolytic disease due to red cell antibodies. There can be maternal autoimmune hemolytic anemia issues, and there can be non-immunological sort of aspects as well. And so, and somewhat relating this, there can be hemolysis, for example, thalassemia major. There can be acquired aplasia, for example, parvovirus, and there can be inherited or congenital anemia. So, for example, again, Diamond-Blackfan syndrome, which is a condition where pediatrics or young people at fetal or neonatal stage that it's been diagnosed where patients have the inability or the bone marrow within patients have the inability to produce or develop those important red cells, typically in relating to the main erythrocytes. And then there can be blood loss typically where, for example, there's blood loss in relating to twin to twin conditions where transfusion may be required in such particular conditions. So just as part of this overview, I just thought I'd provide a resource as has been the case in previous audio podcasts. So there's the International Society of Blood Transfusion, the ISBT Science Series from 2020, and it's a special issue on introduction to blood transfusion from donor to recipient, and it's available at introduction at introduction to blood transfusion. And so there is a link on the ISBT website, and it's it should be downloadable. I like to put out an acknowledgement to Malcolm Needs, who's a transfusion scientist and practitioner in the UK for approach to hematology, and acknowledgement to Professor Ken Jones, Emeritus Professor in Immunology, UK, for the immunology perspective. And finally, just to highlight that this was the third audio podcast in this series. So we've covered pathology automation, so pathology automation, and we've covered an overview on massive transfusion regimes. This was an audio podcast on pediatric transfusion as a general overview, and the next one will be looking at exploring pre-transfusion testing, and then there'll be an audio podcast on the provision of blood for bone marrow transplant patients, and then an audio podcast on the use of plasma products, and then the final audio podcast in this series will be on thrombophilia. So I want to say thank you for taking the time to listen and checking out this audio podcast on pediatric transfusion. This is the Shientist, and in this audio podcast episode on the Rogue Storm episode, it's another Storm Robotics production. Thank you for taking the time to listen in.